So now I'm going to discuss about the femoral sheath. This is very important short note. Okay, university point of view, femoral sheath. What is the femoral sheath is, see, these vessels are all nothing but same vessels. It will be present in the abdomen also. So the femoral artery femoral artery in the abdomen, it is called as external iliac artery. Once it enters the lower limb, it is called as femoral artery. Okay, so what happens, this vessel when enters the lower limb, that is a leg, it is protected by a sheath that is called as femoral sheath. Okay, that is right. Okay, only the vessel, I said only artery and vein will be in the femoral sheath. What will not be in the femoral sheath? Very, very important university MCQ, that is femoral nerve. Okay, please understand, please keep it in your mind. It's very important. Okay, fine. So this is the femoral sheath. So how this femoral sheath is formed, you have to know, right? See, I'll say. So if you take the abdomen less skin superficial fascia, you will have a fascia. So you will have a fascia. Okay, if you will have a fascia anterior wall. If you take the anterior wall of the abdomen, you will have a fascia called fascia transversalis. So if you see in this diagram, this is the abdomen. Anterior wall, you will have fascia transversalis, and the posterior wall, you will have fascia iliaca. So once this two fascias, what happened, it will downward prolongation. Okay, so these two fascia will it will prolong downward into the lower limb, and it will form the femoral sheath. Can you able to understand? Fascia transversalis and fascia iliaca. So this is how the femoral sheath has been formed. Fine ma. So this femoral sheath is divided into 3 compartments. What are those compartments? So we have medial compartment. Okay, we have this medial compartment, we have this intermediate compartment, and we have the lateral compartment. I'll show over here. Okay, same diagram only, I'll show over here. Be very you can able to follow this medial compartment, intermediate compartment, and lateral compartment. Okay, so what are the contents in the lateral compartment? I'll start from lateral compartment. Lateral compartment, you will have 2 contents. One is femoral artery, and another one is femoral branch of genitofemoral nerve. Okay, so femoral artery கூட தான் என்ன ஆகும், இந்த nerve இருக்கும். Can able to see இந்த contents-லே பார்த்துருப்போம். femoral artery கூட தான் இந்த nerve இருக்கும். Okay, so it is present in the lateral compartment. And the intermediate compartment, you have only one content, that is femoral vein. And in the medial compartment is empty. Okay, so இது எல்லாமே ஒரு passage தானே, this எல்லாமே ஒரு passage தான். So since it's empty, this empty compartment is converted into a canal. That canal is called as femoral canal. Okay, can you able to understand? So this this canal is called as femoral canal. So in this canal only one lymph node will be there, that is called as lymph node of 𝗂𝗏 or lymph node of Rosenmuller சொல்லுவாங்க. Okay, they say lymph node of 𝗂𝗏 or lymph node of Rosenmuller. Okay, fine. This is what is called as femoral canal. Fine. So now I'm going to delve a little bit further about this femoral canal. I already said nothing but a short facial tube. Okay, already said. Okay, nothing but that is a empty empty space on the medial compartment of the femoral sheath, that is called as femoral canal. சரிங்களா, already said. So you have to see and you have to understand 2 important words. One is femoral canal and one more is femoral ring, because that will be pertaining to the lymph node situation where it is situated. Okay, so I already said this one, femoral canal and சொன்ன short facial tube. Okay, that is in the medial compartment of the femoral sheath. சரிங்களா, already I said. So the upper end of the femoral canal என்ன ஆகும்னா, upper end. Okay, so this, see, if I take this one, the upper end of the femoral canal, what happens, right now. Okay, fine. The upper end of the femoral canal, what happens, which opens into the abdominal cavity. Okay, இந்த upper end இருக்கும்ல, இந்த upper end அப்படியே எடுத்தோம்னா, very sorry, this upper end which opens into abdominal cavity, this upper part alone. Okay, this upper part which is between the abdominal cavity and the lower limb. Okay, and the upper and the இது சொல்லுவோம்ல cap மாதிரி, that I'll say it, this is called as femoral ring. Can you able to say the ring மாதிரி இருக்கா, this femoral ring, and inside that is this femoral canal. Okay, simple முடிக்கலாமா? See, simple முடிக்கலாம். This is okay. This canal, nothing is there. Is empty. Only one node is lymph node is there. So this is called as femoral canal. So this ring I will say it has femoral ring. Don't forget my students. Okay, many students, all the students, not many, most of the students, all the students will always, what happens means they will confuse what is femoral sheath and what is femoral canal, what is femoral ring. Very briefly and shortly I'll say femoral sheath is nothing but that will cover the vessels once it comes from the abdominal cavity to the lower limb. Femoral canal is nothing but the medial compartment of the femoral sheath that is empty, that has only one lymph node, that is called femoral canal. Femoral ring is nothing but the uppermost part of the femoral canal that opens into the abdominal cavity, that is called as femoral ring. Okay, please understand doctors, this is very important. And in that, so the femoral ring close பண்ணோம் இல்லையா, so the close பண்றதுக்கு we have some from fatty areolar tissue that is called as femoral septum. Okay, so now I'll say the 3 lymph nodes where and all is present. 3 lymph nodes சொன்னல்ல, now I can able to say. So first, so the lowest, மொத்தம் 3 lymph node. So the lowest one is present between the junction between the great saphenous vein and femoral vein, and the intermediate one is present the femoral canal, and the highest one present the femoral ring. Okay, now you can understand, I think. We'll see the boundaries of femoral canal. What is the boundary? So same thing, femoral canal nothing but a passage now. So same, you will have the anterior boundary, you will have the posterior boundary, you will have medial and lateral boundary. So I'll say the medial boundary is nothing but lacunar ligament. You will have a lacunar ligament. Lacunar ligament nothing but, what do you mean lacunar ligament? Now the medial end of the inguinal ligament. So some fibers, what happens, it will some fibers will convert, it will come out. That fibers is called as lacunar ligament. Okay, that that will come out, and that is called as lacunar ligament. So the medial boundary is lacunar ligament, sharp edge of lacunar ligament. And the lateral boundary, already said, you will have femoral vein. Okay, femoral canal இருக்குனா lateral என்ன இருக்கு, femoral vein இருக்கு, that's it. And anteriorly what happens, and what is present in the anteriorly, you have inguinal ligament ma. Okay, can you able to understand? Anterior முன்னாடி inguinal ligament இருக்கும். And what is present in the posteriorly? Posteriorly will have pectin pubis. What do you mean by pectin pubis, doctor? Pectin pubis, see, nothing but, see, I'll show you in this diagram, all the thing I have in diagram. Pectin pubis means nothing. Pectin pubis is nothing but a part in the pelvic bone. Pelvis bone la ஒரு part தான். Okay, if you will have this some ramus, you will have some ramus. The superior ramus, I'll draw over here. I'll draw பண்ணி காமிச்சறேன். See, this is superior ramus, this is inferior ramus. சரிங்களா, ramus வந்து branch தான். இது ஒரு superior ramus, this is inferior ramus. So the line from the superior ramus, this is superior ramus, and this is body. This I will say as body. The superior ramus from the body வரைக்கும் I will say it has pectin pubis, nothing but a part in the pelvic bone, pectin pubis. சரிங்களா, I will say it as pectin pubis. Now I think you would understand this. Okay, that is the posterior boundary. Okay, that's the posterior boundary, and this so then I want to discuss this very important, this 3 lines ma. This 3 lines is very important. Why it is so below the inguinal ligament. So what and all, how we will trace the femoral canal, how we will trace means, I'll say, so the canal lies posteriorly. So what happens, the canal lies posterior to the saphenous opening and thin cribriform fascia, as I said நமக்கு முன்னாடியே சொன்னதுதான் இல்லையா. Posterior, if you take the saphenous opening is present in the, so saphenous opening is present in where fascia lata தான். So fascia lataக்கு மேலே என்ன இருக்கு, thin cribriform fascia இருக்கு. Okay, so அதெல்லாம் எடுத்தோம்னா தான் என்ன ஆகும்னா, you can reach the femoral canal. So it is posterior to the, so these things, so femoral canal lies posterior to these things. And anterior to what, anterior to this pectineus muscle. So இந்த muscle இருக்கும். Okay, so the most posterior தான். So pectin pubisக்கு முன்னாடி இந்த pectineus muscle இருக்கும். So that's why the name came pectineus muscle. Pectin pubisக்கு முன்னாடி இருக்கும். So this pectineus muscle, so anterior to the pectineus, femoral canal is anterior to the pectineus muscle and posterior to the cribriform fascia and fascia lata. Fascia lata la you will have that opening, saphenous opening. This is very important because next I'm going to teach about very important clinical part. Okay, clinical anatomy I'm going to teach, that is femoral hernia. We'll see about femoral hernia. What is there in the femoral hernia, we'll see. So what do you mean by femoral hernia? First of all, what do you mean by hernia? Okay, before going to femoral hernia, you should know, because you are a freshers, you are a first year students, you have to know what do you mean by hernia, right? I'll explain what do you mean by hernia. Suppose if I'm taking a box, and I'm separating by a septum. Okay, or medial or septum போட்டு மூடிடுறேன் box. So after closing it, I'm on the left side, I'm filling the box with some 10 pins. Okay, or I'm filling the box with 10 pins. Okay, 10 pins. But the capacity of the box on the right side is one can accommodate only 5 pins. But I'm filling 10 pins. What happens? The pressure on the box on the left side increases, and what happens? It pushes this septum, and this pins and all. What happens? It comes into the right box, because the right box is empty. Same thing. This is what is hernia. I'm going to say. So imagine this left box is abdomen. Any abdomen la ஏதாச்சும் ஒரு pressure இருக்கு. Suppose any pressure due to pregnancy or something. So a pregnancy, what woman will push, right? So that what happens, any pregnancy or any coughing at that time, what happens, the contents in the abdomen, what happens, so this femoral canal இருக்குல்ல, femoral canal is empty only, right? So that is what is femoral canal. So empty இருக்கு. So what happens, the contents in the abdomen will enter into this free space, that canal that is called hernia. Okay, so since it enters into the femoral canal, it's called as femoral hernia. It's simple. Okay, that is what is being mentioned. Okay, this is the definition of femoral hernia: protection of abdominal contents. For example, loop of intestine. This is a common thing, will be entering loop of intestine through the femoral canal, is called femoral hernia. Okay, so how the patient will come to the doctor? So there will be, how the doctor will elicit that he has a hernia means, in the groin part there will be infolateral to pubic tubercle. Okay, infolateral to pubic tubercle, there will be a swelling below the inguinal ligament. There will be a swelling. I'll show over here. So till here is called inguinal ligament, yeah. So you will have, this is or I'll show over here. I'll show in this. Till here is inguinal ligament. So this is pelvic bone. Imagine this is pubic symphysis. This is pubic symphysis, and you will have pubic tubercle over here, and you will, so the point between pubic symphysis and pubic tubercle, you will have pubic crest. So this pubic tubercle, so infralateral to pubic tubercle. One second. So infralateral to pubic tubercle, you will have some. So here over here, can you understand? I'm able to see infralateral to, that is what he has written, infralateral to pubic tubercle. Okay, in the groin, like the groin. So infralateral to pubic tubercle below the inguinal ligament. That is what he has written. Okay, infralateral to pubic tubercle and below the inguinal ligament. Fine. So already I said this happens when in case of pregnancy or forceful cough பண்ணும்போது. So what happens, pressure in the abdomen increases, and it will so the contents will enter into the femoral canal. So along with this, because see, intestine மட்டும் வராது, not only intestine alone will not come. So all the contents in the abdomen is enclosed in the peritoneum. So peritoneum along with the intestine will come. Okay, peritoneal covering of the abdomen also will come, because very important. Okay, because hernial sac nerthona, it will have some covering. So peritoneal covering is also one of the covering of the hernial sac, this hernial sac. Okay, covering இருக்கும்ல, so how the course it will be, how it will come abdomen lende, when it comes to femoral canal, how it come அப்படினா, how it comes, how it will protrude outside. Okay, how this is protruding outside, இந்த மாதிரி நல்லா தெரியுதுல்ல, how it comes outside means from the abdomen to the femoral canal. First it will pass downward to the femoral canal, then to the saphenous opening. I said அந்த facial artery saphenous opening இருக்கும், then வந்து 𝗵𝗵𝗵𝗃 fascia, இதுக்கு முன்னாடி 𝗵𝗵𝗵𝗃 fascia இருக்கும். Then it will pass upward. I'll show in this diagram. You will get to understand. I'll show in this diagram. See, first of all, femoral canal la varum. Then what happens, femoral canal, I already said அந்த இதெல்லாம் சொன்னேன். Okay, and then what happens, it will go like this. Can you able to understand? There is no, அந்த diagramல சரியா இல்ல. So I'll show this. Finally upward along the superficial epigastric vessels, the superficial fascia, simple femoral canal வந்துருச்சு, then saphenous opening, then in the 𝗵𝗵𝗵𝗃 fascia, then superficial fascia you will have superficial epigastric vessels. Along that it will come. Then the patient will he can see the swelling in the groin part. Okay, this is what the reason. So what is the covering of the hernia? Hernia is nothing but ஒரு loop தானே, ஒரு பெரிய swelling தான். So swelling na definitely you will have the covering. So you will have skin. First of all, outermost covering na you will have skin. I will show skin first of all. Then what happens? After skin, what happens? You will have superficial fascia. Yeah. Then after superficial fascia, what will be there? Okay. So see, first of all skin, then superficial fascia. Then after superficial fascia, what happens? You will have cribriform fascia. Yeah. After superficial fascia, you will have cribriform fascia. And after cribriform fascia, you will have fatty content of femoral canal. Okay, you will have fatty contents of femoral canal. If you see over here, you will have fatty contents of femoral canal. This is fatty content, extrapenile fat. Then after that, you will have femoral septum. Okay, then peritoneum. Peritoneum irukkulla. That's what I said. One of the covering is called peritoneum. Okay, so what do you mean by strangulation, ma? Strangulation of femoral hernia is very important. What do you mean by strangulation of femoral hernia? Okay, many books is not there. Only now it has included in your portions. Only in last year it has included strangulation of femoral hernia. That is, when this hernia, this loop of intestine, okay, I said right, the abdomen length. So imagine this as abdomen. Imagine this as abdomen, and this as femoral canal. Okay, when the contents of the abdomen, it enters the femoral canal, it gets stuck. Up then what happens? How the patient will feel? Summa swelling irukadu. Along with swelling, you will have some vomiting, it will have some pain, nausea and all. So nothing but it has. So in the chinna passage that many contents has been stuck. So how the surgeon or the doctor, how he will release it means, what happens? He will see, already I said, I shown here. So medial boundary is lacunar ligament. What happens? He will okay. So he will enlarge the femoral ring. In the femoral ring, he will make enlarge. Then what happens? When enlarge pantona it will be better, right? So he will feel better. So for that, what happens? He will cut some lacunar ligament. So while cutting the lacunar ligament, sometime occasionally what happens? The patient will bleed. Why? Because occasionally because some patients will have in the lacunar ligament keela, you will have one important artery, not important artery, you will have abnormal obturator artery in solvom. Okay, it will run beneath the lacunar ligament. Abnormal name itself, abnormal lacunar artery. So while the surgeon cutting this lacunar ligament, so inadvertently தெரியாம என்ன பண்ணுவாங்கன்னா, he will cut this artery, so it will severely bleed. That one thing. Okay, so then if you leave like this, okay, so sometimes some patient will think, okay, சும்மா ஏதோ கட்டியா இருக்கும் அப்படின்னு விட்டுருவாங்க. If you leave like this, what happens? This femoral hernia will become how it will become U shape. Okay, இவ்வளோ பெருசா தெரியும். Okay, if you leave, okay, சில பேஷண்ட் என்ன பண்ணுவாங்க தெரியுமா? சில patients, okay, some patients, what happens? They will make this hernia very severe. Hernia இருக்குன்னு தெரியும், but they will assume like, okay, சாதாரண கட்டி தான் அப்படின்னு. So what happens? It will grow and it will become U shape. It will become a U shape. So this femoral hernia is more common in females only. Why? Because females have the pelvis is very big, right? So since pelvis is big, femoral ring will be larger. So femoral ring larger இருக்கறதால many contents of abdominal contents will enter the femoral ring, so it will become very larger. That is what. This is over, man. Then now I'll teach about the adductor canal. It's very important short note. You repeatedly ask university short note, adductor canal. We'll talk about this. Adductor canal. So adductor canal is otherwise called as subsartorial canal and Hunter's canal. Okay, please do remember this one, because in university examination sometimes they will ask 95% they will ask adductor canal only. Sometimes they may ask Hunter's canal. Okay, sometimes they may ask Hunter's canal, and rarely they will ask subsartorial canal. Why? Three names are given. I will explain it. Okay, first of all, what is adductor canal? Nothing but, see, the contents of the femoral triangle have to enter into the leg, right? So thigh irukku, it has to enter into the leg. How it will enter? It will enter through popliteal fossa. Okay, popliteal fossa and through, likewise on the upper limb we would have been seen in the upper limb. In the upper limb we would have been seen arm. Then you would have been seen forearm. So in the arm kum forearm kum nadula we would have been seen cubital fossa illaya, cubital fossa irukum. See, because this is the arm, this is forearm. So the vessels or anything that is going to enter from the arm, enter the forearm from the arm, right? So it will safeguard from in that you will have a depression. Same depression you will have here also. Okay, so till thigh, this is thigh, and after thigh you will have leg, right? So the leg kum thigh kum nadula you will have a depression that is called as popliteal fossa. This will be dealt in another session, don't worry. So popliteal fossa, but this cubital fossa is present in the anterior aspect of the hand, that is on the upper limb, but this popliteal fossa is present on the posterior aspect, because anterior aspect you will see the knee, right? So the patella knee irukum. So popliteal fossa will be present in the posterior aspect. So what happens, this femoral triangle contents are all the femoral artery, nerve, and the idella irukku illaya, so the vein that will enter the popliteal fossa through a passage. That has to enter the popliteal fossa through a passage. Thigh, this will enter the, see, upper 1/3 you will have the femoral triangle, lower 1/3 you will have the adductor canal. Simple man, that is what full thigh. Upper 1/3 we have femoral triangle, and lower 1/3 we have adductor canal. What is the purpose of adductor canal? Nothing but the contents of femoral triangle has to enter the popliteal fossa through a passage that is called as adductor canal. Okay. So can you able see this intermuscular tunnel? So full muscle da irukum. Full muscle tunnel is situated on the medial side. So the medial side la irukum, on the middle 1/3 of the thigh. Okay, middle 1/3. So same. So what is the apex? So see, if I cut this tunnel, it will in the cross section it will be like a triangle marida. It will also be a triangle. So apex la, what is the apex has? Apex is nothing but it has femoral triangle. Base, what happens? Base, or where it ends na, it will end in a muscle. La adductor magnus, no very important muscle will be there. In that muscle, likewise I said, right, fascia lata, you have an opening called saphenous opening. Same thing in the adductor magnus, you will have a tendinous opening that is called as adductor hiatus. Okay, I think this is here, it is not there over here. Adductor hiatus, adductor, write the spelling as adductor. Okay, adductor hiatus, right over hiatus, HAITUS. Okay, hiatus, adductor hiatus. Okay, there it will end. Fine. So we'll see the boundaries. So it is triangular in cross section. We'll see the boundaries. So boundaries already I said. So see, yes, boundaries will be a little bit tricky. Tricky means what? See, cross section it will be like a triangle, right? So anterolaterally, anteriorly and laterally. If you see, if you take like this, it is like this. Sorry. Okay. So anterolaterally, what you will have vastus medialis muscle. You have vastus medialis muscle. I will show in this diagram. We'll finish off. Okay, in this diagram. Okay, so anterolaterally you will have anteriorly and laterally somewhat. Okay, you will have vastus medialis muscle. Fine. And posteriorly and posterior aspect, and also it forms the floor. You will have adductor longus muscle above, and beneath this adductor longus muscle you will have adductor magnus. Okay, because adductor magnus na primordial, I said, right, there will be a tendinous opening called adductor hiatus. So the posterior boundary and the floor it will form. Posterior boundary da form pannom, because these boundaries and all it will form both boundaries. Okay, anterolaterally it forms boundaries vastus medialis. Posteriorly, and the floor is formed by adductor longus and above, and adductor longus above and adductor magnus below. Fine. Then medially what happens, it is formed by a strong fibrous membrane. This is strong fibrous membrane stretching across the boundaries of anterolaterally and posteriorly. So above the strong fibrous membrane you will have a muscle called sartorius muscle. Okay, above this you will have sartorius muscle. Fine. So what happens, this is what sartorius muscle, this is what he would have been said over here ma. Okay, this thing is very very important, I'll say. So beneath the sartorius muscle what happens, you will have some plexus of nerves. Plexus now no la nariya nerves. What happens, some 4 to 5 nerves or 10 nerves, what happens, it will become branches and it will join in a particular junction. That is what is called as plexus. Okay, like four street come and land at a particular junction likewise. Okay, many branches now in the edathila now it will become junction. That is what is called plexus of nerves. So since it is beneath the sartorius muscle, it is called subsartorial plexus. Okay, so see this passage la plexus is very rare. Okay, so since this passage la you have subsartorial plexus, this adductor canal is otherwise called as subsartorial canal. Okay, subsartorial canal. Hope you understand why it is otherwise called as subsartorial canal. Okay, we have subsartorial plexus over here. That is why it called a subsartorial canal. So now we'll see the contents content same mass. Okay, so same what all contents you have in the femoral triangle, same contents will be there, but some will differ. So you have femoral artery, you have femoral vein, then you will have nerve to vastus medialis, then you have saphenous nerve. Okay, in the femoral triangle தான் என்ன இருக்கும், femoral nerve இருக்கும். I said right, after femoral nerve what happens, below 2.5 cm below the inguinal ligament divided into anterior and posterior division. The posterior division it gives rise to saphenous nerve. That saphenous nerve enters this adductor canal, saphenous nerve. Then occasionally you have this anterior and posterior division of obturator nerve. Occasionally you will have this. Then you will have a branch of femoral artery, that is descending genicular artery. Fine. I'll say this course, okay, I'll finish off in another 5 minutes. Okay, just be with me. I'll finish off in another 5 minutes. Okay, so this femoral artery is nothing but, okay, so what happens, it passes the whole of this canal. It passes the whole of the canal. Okay, so before leaving this canal, okay, it passes in the whole of the canal, whole length of the canal it will pass. Before leaving the canal, what happens, it gives many muscular branches. Okay, it will give many muscular branch and will give only one branch, that is descending genicular artery. Before leaving the canal, it will give one branch, descending genicular artery. And femoral vein is very simple. Okay, what happens? Okay, so what happens now? In the upper part, what happens? It is posterior to the femoral artery, and the lower part, femoral vein is lateral to the femoral artery. Fine. Then saphenous nerve. This is very another. I said two. I will deal two important university MCQ question. One I said about that femoral sheath femoral nerve mattum enna irukona, it will be outside. Okay, femoral artery and vein will be inside the femoral sheath and femoral nerve will be outside the femoral sheath. Another one is this saphenous nerve is the longest cutaneous nerve in the body. Cutaneous nerve na something, the nerve that supplies the skin. So skin supply பண்ற nerve is the longest nerve. Saphenous nerve is the longest nerve. Okay, please have it in your mind. Saphenous nerve is the longest nerve. Fine. Fine, ma. So then nerve to vastus medialis. Nerve to vastus medialis. So nothing but it is present in the upper part laterally and will supply the vastus medialis muscle. Sorry, vastus medialis muscle. Okay, vastus medialis muscle. This is something occasional, man. This is very occasionally they will have this obturator nerve. Okay, just if you write this anterior and posterior, that's enough. You don't want to explain its cause and all. So I am going to end by a clinical correlation of this adductor canal. So adductor canal. So why I should explain this clinical correlation in order to say why is adductor canal otherwise called Hunter's canal. 95% they will examine if the examiner wants to make the paper tricky, he will ask the another name of adductor canal, Hunter's canal. People will leave, students will leave, so you should not leave adductor canal, otherwise called as subsarterial plexus. I said why, because you have subsarterial plexus over there. Why Hunter canal, I'll say. So already I said in popliteal fossa and sonal, I said popliteal fossa. So popliteal fossa you will have one artery called popliteal artery, nothing but it's a continuation of the femoral artery. So femoral artery in the thigh will say femoral artery. In the leg, so after entering the popliteal fossa, I'll be saying it has popliteal artery. In the popliteal artery, sometime aneurysm of the popliteal artery. Aneurysm means nothing. Aneurysm means swelling. So swelling of the popliteal artery, what happens? See, for example, I'll draw and show. Understand? Suppose understand, this is the leg. This is leg. I have femoral artery over here. Then this is popliteal fossa. Fine, this is popliteal fossa, and I have, and this femoral artery in the popliteal fossa. What I'll say popliteal artery. So in the popliteal artery, sometimes it gets swell. That is called aneurysm. Aneurysm, not swelling. Okay. So what happens? Surgeon will what happen, right? So he will cut this part of popliteal artery. He will cut this part of popliteal artery. Okay. So then what about, you will cut and it will ligate. So in the part if you have to ligate, right, cut panni appadi vidutta, how we will circulate the blood. So you have to ligate. So that ligation will be taken place. So that ligation will be taken place in the adductor canal. Here adductor canal will be right there, right? So on the adductor canal that ligation will happen. That adductor canal that ligation will happen, not in the popliteal fossa. See, popliteal fossa popliteal artery is becoming aneurysm, that is swelling. But fine. So I'll be ending this session by discussing a very important clinical aspect of adductor canal. So what's that is, see, during surgery of aneurysm of popliteal artery. So first of all, you should know what you mean by popliteal artery, right? So you'll be studying this in the upcoming sessions, okay? So don't worry about this. I'll just explain a little bit, okay? So you should know popliteal artery is nothing but the continuation of the femoral artery. See, in the femoral, in the thigh, we'll say, so once from the in the abdomen, external iliac artery. So that external iliac artery, when it enters the lower limb, that is the thigh, it is called as the femoral artery. So once the femoral artery enters the popliteal fossa, see, you will have a popliteal fossa, I already said, right? So you will have a popliteal fossa between leg and between thigh and the leg. Between thigh and the leg, imagine this is the thigh, right? So this is fully the thigh, this is fully the thigh. So after this is popliteal fossa, after this leg will continue. So between these two you will have a depression, like how in the arm we have arm and forearm, in between we have cubital fossa. Same thing will have popliteal fossa, but on the posterior aspect of the because on the anterior aspect we will have that patella bone, right? So it will be present in the posterior aspect. So what happens, this femoral artery, when it enters this popliteal fossa, it is called as popliteal artery. So why this adductor canal is so important as clinical aspect means, I'll discuss here. See, for example, imagine this has a thigh, and this has femoral artery, and this is popliteal fossa, okay? So between thigh and this is leg, fine. So the leg, so this from femoral artery once enters this popliteal fossa, it is called as popliteal artery. So what happens in during the popliteal aneurysm of popliteal artery? Aneurysm is nothing but swelling. See, suppose the swelling of popliteal artery. So what happens during swelling of this swelling, right? So swelling. So what surgeon will do? What surgeon will do is, he will cut out this. He will cut this aneurysm, because the swelling, aneurysm is nothing but swelling. So he will cut this part of. He will cut this. I'll show over here. He will cut this part of swelling, that is aneurysm, and he will ligate the popliteal artery. That is nothing but he should ligate the popliteal, because he has cut, right? So he has to tie up. Ligation nothing but tie up. He should again tie up. So where he will tie up is, he will so what happens, he will expose this part of femoral artery. So in the part of femoral artery, so he will where he will tie is, he will tie in the adductor canal. Why he will tie in adductor canal and not in popliteal fossa is, so when you tie artery in the popliteal fossa, it is not healthy, and it will tear immediately. So whenever if we tie artery in the adductor canal, it will be healthy and it will not tear. So for that purpose, so what happens, the surgeon what happens is, he will expose the adductor canal, and he will take the femoral artery, and he will tie the artery over here. So because he cut, so he will tie the artery in the adductor canal. So this procedure was first done by a surgeon called as John Hunter. So since he has first done this procedure, that is the surgery, so this adductor canal is otherwise called as the Hunter's canal. Hope you understand. Thank you. Fine. Thank you, ma'am.